hand raising box. Thank you. So I wanted to take this opportunity today to just take a closer look at this particular population. So what we're going to go through is just some general senior wellness, the importance of nutrition, and then also looking at nutrition for particular chronic disease states and some things to pay attention to within that arena as well. And then also what we can do or how we can advise to just really support someone and in their aging process too. So let's talk through our senior wellness. So why or what may be important about this? Just as we are going and getting through kind of life here, we know that people over 65 years of age make up about 16% of the population, and that is rapidly growing. And so it's expected to continue, and by 2040, there will be about 80.8 million senior persons. And that's more than twice as many as what was in the year 2000. So this is definitely a population that is going to need some care and support and paying attention to. So nutritionally, we know that 70% of seniors may have low micronutrient levels. I also, in particular, think about some of those micronutrients that help support brain function as someone ages. And so also within those population, we have about 85% of senior adults that have at least one chronic condition, and 60% have at least two. So a couple of factors that we're trying to support. And so there's an increased need of nutritional services and an increased need of direct nutritional advice within supporting your patient, your client, and then also maybe their family too. So I look at sometimes if I'm starting to look at like what would be the basics. So I'm looking at balanced macronutrient intake, carbohydrates, protein, fat. Sometimes that's hard to think through how to balance that out on a day-to-day basis. I'm looking at eating to support immunity, bone maintenance, and prevention of bone loss, muscle function. I'm also looking at it in terms of chronic diseases and how to support those, how to prevent them from worsening or possibly improving those chronic disease states. Then I also just think of the food and the physical activity as socializing tools as well as that group kind of effort. So we also know body changes with age. So some things to look out for in this kind of senior population and senior wellness overall. Definitely looking at an increase in overall fat mass and visceral fat, and a decrease then in muscle mass. So kind of trying to balance that out for a supportive body system. We do see decrease in mobility, increased risk of falls, decrease in metabolic rate, and then just changes in oral and gastrointestinal results that could lead to difficulty eating, such as difficulty in chewing, or if someone's stomach or GI tract goes slower in terms of moving through food through it, then that is actually going to be difficult to get food in, maybe a texture or even the amount of food as well, which is just a kind of a concern, potentially with also getting in those micronutrients that usually come from food. So it's all kind of full circle. Physical activity, if I'm looking in general with our senior wellness, physical activity helps with several things. So that lean muscle mass, or at least trying to preserve it, balance, coordination, flexibility, cardiovascular health and conditioning, does help with cognitive function and brain function, provides that social interaction that is oftentimes dismissed or not happening as often as someone ages. Physical activity may also improve appetite as well. And so the goal with that would be 30 minutes or more, at least 5 days per week. And it doesn't have to be anything intense. I really just look at it as movement and help my patients and clients just try to move a bit every day. So some of the barriers, which I think is really important to mention, because of the fact that this just is that snowball effect. If there's a barrier, then that nutritional support or that nutrition through food or even nutrition through potentially a product could be difficult to get in, which then kind of leads down to intense chronic conditions or non-improvement of a chronic condition, and also can lead to not preserving someone's macro or micronutrients. So some of these just general barriers. Maybe there's a difficulty in shopping, and that could be almost anything. That might be transportation to there. It might be decision-making around it. And also maybe the cooking aspect to it too. There's also a sense of change in taste and smell. So whether that be a loss or that things taste more intense. So intense, like if something's sweet, then it tastes super sweet, or if it's salty, it tastes super salty. And that may throw off someone's ability or just desire to eat. There is also those oral changes, such as chewing and swallowing. And so that may need to be considered as far as a textural change. And then meals and exercise alone may not be as fun or exciting. So just trying to really help that out. So I do think of Healthwise products and almost integrating this into my care. As a dietitian, I'm oftentimes trying to think through the ways that I can really help someone take advice and put it into action. And so some of our senior patients may be interested in having just a solution or something there that's really quick, easy, doesn't involve a lot of work, doesn't involve a lot of cooking, and those can be designed or changed around to support whatever is needed. So if it's something that is weight loss, or if we're trying to work on muscle preservation or easy meal preparation, there's something there. So I do kind of mention that to think through just on terms of practical solutions for our senior patients. So let's look at the nutrition part. So nutrition and aging, oh gosh, there's so many thoughts to this of kind of just supporting through nutrition, supporting all the different things that kind of change. And so I mentioned the kind of oral changes and the chewing, and there's also taste and saliva production, dry mouth, gastrointestinal motility, maybe appetite or cognitive function. All of those things take into account how someone can support themselves. And then also vice versa, nutrition can actually really help improve all of these different things, such as cognitive function and B vitamins. And so just to name a few there. So what could maybe be some goals in looking at this? So maintaining a caloric balance and really focusing on sustaining a healthy weight. And I look at that in both ways, whether that is, so I'm trying to prevent someone from losing too much weight and they need to go up a little bit more, or they're increasing that visceral fat mass and I need to get them into more of a healthy weight range. So really making sure that I do that. I also want to increase or make sure that I have enough protein intake in order to help preserve lean muscle mass. I do think through potentially a multivitamin or something outside of food to help support those micronutrients if they're not able to really be taken in through food. So think of those omega-3 fatty acids or there's, really healthy fats. That's going to help several things, brain function and cognitive decline. It helps support. It also helps support skin condition and issues there. And then also I look at the cardiovascular health with those really healthy fats as well. We want to decrease those unhealthy fats, maybe salt, processed foods. I do think of fortification, because if I'm having a difficult time getting nutrition in because of changes, lack of desire, oral changes, GI changes, then I might need to think of how I can fortify things to really get that nutritional balance. And then water consumption too. I oftentimes might do a beverage that is like a smoothie. So then I have some things added to it, but also I'm trying to increase that liquid or that fluid or that water intake too, because that oftentimes improves bodily functions, but is oftentimes forgotten in our senior patients. So trying to get the most bang for my buck here with nutrition. So I do think of prevention and maintenance because, as we talked about earlier, quite a few of our senior patients have at least one chronic condition. So in just thinking of someone's overall health, I'm also thinking of prevention, maintenance of those chronic conditions. And just keep in mind that whenever I'm making recommendations or whenever I'm kind of thinking through this, I want to make sure that I'm consulting or touching base if I'm giving a product, or if I'm kind of talking through some solutions with my patient or with their family. I want to make sure that I'm looking at medication, kind of nutritional interactions, and if there's anything that could be of concern. So just a tidbit reminder for everyone here as we talk through some specific products. So things of note that I keep in mind, I mentioned micronutrients and I mentioned B vitamins, absolutely important. I really, really think through B12, because that, in order to digest or in order for our bodies to take in B12, we actually need, from our stomach, we need what's called intrinsic factor to buddy up with B12 in order to absorb. And so as our stomach function ages, then that we lose that ability. And so we might need additional supplementation to make sure all of our bases are covered. Vitamin D and calcium, both of those, I think, through for bone loss, or let's say bone maintenance too. And so wanting to kind of think through supplementing those, or if it's something that I can also add in addition with food. Most of the time I'm needing to supplement it just because less time outdoors, less ability to get in those calcium-rich foods for people. And so I do think of supplementation with that. The other ones I'm thinking through, fiber. So fiber, the needs decrease in age. However, it's really important with fiber. It's kind of like a scrub brush for the digestive tract. And with that, it helps to prevent constipation. It can help with that GI motility. And so I look at potentially psyllium husk or like a wheat dextrin. Psyllium can kind of bulk up a little bit for people. So I know I've heard from kind of that area that for some, it feels like it bloats them. Wheat dextrin doesn't feel as much as it bloats people, or we can use a combination of two, but sometimes it's finding that right fit for an additional fiber for people, especially if they're not getting in vegetables, green products, stuff that would support that. And then I also think through my essential fatty acids. So with this, definitely for the cardiovascular health effects. And so I am thinking food wise, I'm like, okay, walnuts, fatty fish, but that might not be of interest for someone, or maybe that's something that orally they can't chew or can't really take in. So I definitely might consider or really think through a supplement for this. And we want that ratio of omega-3 to omega-6 fatty acids in order to be able to cover all the bases. So if I'm looking at a couple things, I do want to mention some of the Healthwise products with this, because I find that they've been really, really helpful in terms of being able to have something available and a practical solution. And so just think there are a million different fiber products on the market. So if I know that sometimes I have trouble kind of navigating that, I could only imagine my senior patients trying to navigate that. So it's helpful if I'm actually a bit more direct and saying like, okay, I want you to take this, or I want you to add this to your water or to your soup or to your smoothie. And so it helps to cover a couple bases. It does help with that fiber intake, with that GI motility. And then also if I'm adding it to a liquid, it also helps with the liquid intake too. So again, all those kind of value adds. And then I do look at omega-3 fatty acids, or those as really essential fatty acids. I know I always go towards omega-3, but we do want those omega-6 going in there. And so taste is a really big thing, as I mentioned, for a lot of senior patients. They have that amplified taste or that amplified smell. And so I'm wanting to make sure that I have something that isn't going to throw someone off. So with this one, it doesn't have that like after fishy taste. And so this is something that I can be much more directive to add in to help prevent further cardiovascular issues, but also this helps with brain function as well. So I'll do kind of both with this. Do think through some protein needs. And so just as I'm hitting my different bases, it sounds like, oh gosh, there's a lot of different things I have to think through nutritionally. And what I've found overall is keeping all of these things in mind, but seeing what we can put together, or how we can kind of put things together to be able to be pretty straightforward and pretty, let's say pretty easy. So let's say we're utilizing a protein smoothie, or we're utilizing something. It's easy for someone to take that information from me and says, oh, Katie says, get in that protein smoothie. This is the one that you're supposed to use, and you're going to add fiber to it. And that's something that can be done and much more directive than increase your protein. So facts with this, protein needs definitely increase as someone ages due to muscle wasting. It's a fine line. We don't want too much protein. We don't want too little protein. So there is that kind of calculation there of our body weight per day for grams per kilogram. And that can help someone just get a general sense of how much protein or someone's protein needs per day. And so I do just wanted to mention some other of Healthwise protein products. Again, I'd rather be much more kind of directive in this, because I don't want to overwhelm someone. And my whole goal is to find really, really practical solutions to be able to get nutrition into someone to support them overall. So let's talk chronic diseases and what those look like. So a couple of things that I look at here for some certain things. So within diabetes, I'm definitely thinking about this not only as a blood sugar help and control, but I'm also thinking about the connection with some other health outcomes too. So I want to help be preventative of this. So some nutrition thoughts and tips with this part would be that increase in complex carbohydrates, looking at those processed foods, really looking at that fiber, and if there's a grain product, choosing whole grains, less red meat, less processed meat. And then I also think about frequency in eating too. So there's not too long that someone's blood sugars start to go really low and then they bounce up really high. So I look at that frequency in eating as well. So some products that I found to be really helpful with Healthwise is actually looking at low carb products that have a bit more protein. Especially as someone, maybe they've been used to kind of looking at carbohydrates and kind of carb counting, and potentially that might also become more overwhelming as someone ages. So using a product to be like, it's already figured out for you, and then adding that in to someone's day by day can actually be really helpful. So I've added that with some of my clients just to help take some of that pressure off, and then also guaranteeing my nutrition or my nutritional aspects that I'm trying to make sure get in there. Then cardiovascular disease, definitely part of the picture. So I'm thinking of blood pressure, I'm thinking of heart health, and some things to think through of that is the saturated fat intake and helping out with healthier fats and thinking through those omega-3, omega-6 fatty acids. So I might utilize like a kind of a pill form or a product, such as the essential fatty acids. Look at salt intake, fiber through fruits and vegetables, a lot of color I like to add, and then plant-based protein as well. So again, some products that I think about with kind of this and with that support, but also I'm also thinking through maybe some of the oral changes too. So if I do have to have something that is texturally maybe a little bit softer, or texturally maybe a little bit easier to swallow, or is like a soup or a stew, there's a lot of great choices there that again can cover several of my bases and just make this easier. Cancer. So with cancer, I think of with age, I think of cancer risk and trying to prevent that. So I do think through anti-inflammatory foods. So I think of like fruits, and I think of typically like my reds and my purples, those really brightly colored vegetables like leafy greens, and then protein that's going to have an essential fatty acid component to it, like salmon. Decreasing on my processed or my overly processed food, let's say. So, and what I kind of look at that, or how I kind of can categorize that a little bit easier, is that we might utilize like a product, and mentioning Healthwise and some of the things that they make, we might utilize a product that is already made, but we're not utilizing a product that is overly flipped around, switched, have a lot of additive of ingredients to it, and is one of those that it could be on the shelf for years and years and not have a change to it. So there's a little bit, I think I wanted to just define that processing part, so there's a little clarity with that. So with cancer, I have used preventative products for cancer, and just kind of utilizing some shakes, some smoothies, and soups, and just kind of adding in some different things to help that inflammation effect to it. Dementia, this is actually really, really common. About 1/3 of adults over age 85 have some form of dementia. And so this is, that thinking, that decision-making, that feeling of overwhelmness with a decision really comes to play with this. And so I do think through the limiting of added sugars, saturated fat, salt intake, and really looking at balance. And as I mentioned, the brain health part. So I do think through with the brain health, my B vitamins, and I think through my essential fatty acids. Those are probably my top two. So how do I get that in with food? And I find products really useful for this population, because it's already there, and it's already something that is not going to be overwhelming. It's like, this is what you're going to have per day. So I might use some shakes, smoothies, maybe mashed potatoes, something that is not really hard or orally hard for someone to take in. Soups, and again, I try to get the most bang for my buck, especially if someone is forgetting to eat or not eating as actively. Then am I going to utilize a Healthwise product potentially that has some extra protein to it, or that we can add some fiber to it, or it covers those blood sugar bases. So just think in mind, our wellness changes through the life cycle, but nutrition and physical activity, they're vital to this. Healthy nutrition can aid and really support this aging process, and helping to direct that can really help our clients, and potentially utilize Healthwise as their products offer a lot of variety. And it could be something to just add a senior program to your to your office or to your practice in order to really help manage and prevent those chronic conditions as well. So this is me. I am up here. It's my contact. And then if you're also interested in adding any Healthwise products, or just kind of considering just even talking, wanting to know more, please reach out to them directly. I'm going to take a look at our Q&A. I'm happy to stay on. I know we are getting right to the end of our quick presentation today, but I'm happy to stay on and answer any questions as needed. I'll also, at the same time, too, allow everything to be unmuted. So if that's easier for you, I'm happy to take something directly as well. So thank you. And please let me know if there's any additional questions or anything that I can answer. And again, hope everyone's having a really, really wonderful day so far. Okay, I don't see anything coming in through the Q&A. And I hope that, if anyone wants to unmute, I'm happy to answer through there. Or if you are having a hard time doing that and you need to pop a chat or a question, let me know. I'm happy to help with that way too. Okay. So it looks like I don't have any questions coming in. So I hope everyone has a wonderful, wonderful day. And thank you for joining me and for joining Healthwise, who sponsored in this presentation, in bringing some really healthy, thoughtful products and solutions for your senior patients. And so good luck, everyone. And please reach out to myself or to Healthwise if we can answer any further questions. Have a great rest of your day.